a professional. This is the other presentation regarding depression treatment. If you guys remember, I talked about the previous presentation regarding the depression symptoms, the mnemonic SIGI caps, and how we remember the symptoms of depression. We talked about the severity of depression and how the depression is classified as mild, moderate, and severe. And we talked about the screening of depression and how we screen depression and find out what's the score for somebody having depression, and how we treat depression using the PHQ-9, the Patient Health Questionnaire 9, which is very effective tool, help us to find out if somebody depressed so that we can treat accordingly. And as I told you previously, I told you next presentation gonna be about the treatment of depression. So here we go. Today I'm gonna explain about pharmacological treatment or medicines used for depression. Well, actually, if you ask me from where I get in this information I'm getting from the Agency for Healthcare Research and Equality. AHRQ is a federal government research agency. They funded a lot of researchers actually to do a huge research. Actually, they did 248 studies published between January 1980 and January 2011 on second generation antidepressants. Antidepressants, which are the medication used for treating depression. So let's get started. What kind of medicine used for depression treatment? Let's see. So if you let's get started and talk about how depression actually treated. How depression treated is treated with medicines, talk therapy. What's a talk therapy? Is where a person talks with a trained professional about his or her thoughts and feelings, sometimes called psychotherapy or counseling. Or we treat actually depression in combination of the two, medicine and psychotherapy. So either one or in combination. So let's talk about the antidepressant medicines used. Let me talk about, there is I actually collected the brand name and generic name and whether it's available in US market actually. So let me talk about the brand name. For here actually there is a SR, XL, and CR, XR. I'm gonna talk about this in details after I go through everything here. So let's get started with Wellbutrin, generic available, yes, for some doses. The generic name bupropion, and Celexa, the brand name Celexa, generic available, yes. The name is citalopram. The other one, Prestige. Generic name is not available, called desvenlafaxine. Cymbalta, the brand name, generic name not available, duloxetine. Lexapro, other brand name, generic name not available, escitalopram. The other brand name, Prozac, which used weekly actually, brand name, generic name available, fluoxetine. The other one, Lovox, generic name, yes, available in the market, called fluvoxamine. Fluvoxamine. And the other one, Remeron, generic name, yes, available for some doses, mirtazapine. And the other one, Serzone, which is not available in the US actually, but generic name is available, is nifazodone. The Paxil CR is available, generic name also called paroxetine. Zoloft is available, brand and generic, called sertraline. And the other one, Dicerol, available generic and brand name called, the generic name called Trazodone, and the other one Effexor or Effexor XR, yes, available for some doses, called venlafaxine. Okay, after I went through everything here, let me talk about what do the letters SR, CR, XR, XL after the brand name means. Okay, medicines with this letter actually are forms of the medicine that delay or extend the release of the medicine in your body. This means that the medicine stays in your body for a longer period of time, and you may be able to take the medicine for less often actually. Per se, Wellbutrin SR. What's SR means? SR is a sustained release medicine. You take this medicine twice a day. What's the CR means? Here for the Paxil, CR, it is a controlled release. CR, controlled release medicine. You take this medicine once a day. And for the XR, Effexor, what XR means, or XL for Wellbutrin means, and Prozac weekly, this one too, are extended release medicines. You take Wellbutrin XL and Effexor XR once a day. You take Prozac weekly, once a week. All right, how does these medicines work? All right, antidepressant medicines actually help improve the way your brain uses certain chemicals that control mood or stress. Remember the first presentation I talked about the chemical imbalance in your brain? That's one of the major causes of depression happens. So these actually medicine, they control the chemical imbalance, so they improve your depression status. Excuse me, what does research say about how well these medicines help people with depression? All of the antidepressant medicines work about as well as each other to improve the symptoms of depression. All right, but we have to remember that some people will not feel better with the first medicine they try, or they won't feel better the first 2 weeks, probably 1 or 2 weeks they take in the medicine. So it needs some time until this medicine works. So if the first medicine failed, they may try several medicines before finding one that works for them. Okay, so others may find that although the medicine helped for a while, their symptoms came back. It's important to follow carefully your doctor's directions for taking your medicine for it to work. Okay, so it's very important to follow up with your primary care physician to find out what's going on, whether the medicine works or not. Okay, now, what did research find about specific antidepressants? Research has found some specific information about the benefits of a few medicines. People who took mirtazapine, Remeron, this one, so if the people who took Remeron start feeling better faster than they did on other antidepressants. Remeron took about 1 to 2 weeks to start working. So we have to make sure to wait a little bit until the medicine works. Prozac weekly and Paxil CR worked as well as regular Prozac and Paxil. If your people stop taking venlafaxine, which is the Effexor or Effexor XR, which is this one, because it was not working compared with other antidepressants. People who did stop taking venlafaxine stopped it because of side effects such as nausea and vomiting. Okay, so can antidepressants help with other problems related to depression? What do you think the answer is to this question is? It is yes, for sure. So what kind of other problems related to depression? First of all is anxiety. Anxiety, people with anxiety or having depression, actually, they help out. Actually, when you take an antidepressant, it helped out a lot. Actually, the other thing, if they having pain with the chronic pain, medication like Paxil and Cymbalta helped out a lot. Actually, Cymbalta is a medication used for fibromyalgia. And insomnia, also the other condition, could help out if you use antidepressant medication. What's insomnia means? When you cannot fall asleep, stay asleep actually. What medication could help out with? Prozac, Remeron, Paxil, and Zoloft. Okay. Now, what's the depression medication side effects? A lot of side effects of medication. Every single medicine could has its own side effects, but with the antidepressants, actually medication, according to the US FDA, Food and Drug Administration, they found out that the most important side effects from antidepressant medication: nausea and vomiting, weight gain, diarrhea, sleepiness, and sexual problems. So there is other kind of side effects, actually minor side effects. It could happen with antidepressant medication, like seizures, heart problems, imbalance of salt in your blood, liver damage, suicidal thoughts, or serotonin syndrome, which is a life-threatening reaction where your body makes too much serotonin, which is a hormone inside your brain, and then you're gonna get shiver, diarrhea, fever, seizures, and stiff or rigid muscles. All right. So mostly nausea and vomiting happen with venlafaxine or Effexor XR, or Paxil. Weight gain mostly happen mirtazapine. Actually, Remeron. That's a really ideal medication for people losing weight with depression. We prescribe mirtazapine or Remeron, which is the brand name, to help them out with their weight loss. Diarrhea mostly happen with Zoloft. Sleepiness is happen with Diserol or Trazodone. Sexual dysfunction, such as decreased sex drive or difficulty getting an erection, could happen with Paxil or Paxil CR, control release, or it could happen with Lexapro or Prozac Prozac weekly, or could happen with Paxil or Paxil CR, could happen with Zoloft. And other sexual side effect than Wellbutrin or Wellbutrin SR, Wellbutrin XL. Okay, now this is the end of presentation today. I talked about the medication, and the next presentation, this is part one, actually talk about medication of antidepressant medication. Part two, I'll continue talking about this, what will happen if you discontinue or you stop using your medication, what will happen. And then afterwards, I will talk about the non-pharmacological treatment of depression. So I want you to stay tuned and watch. For my next presentation, please give me the thumbs up and subscribe to my channel for more presentations. You have a good day now.